there will be no
मॅम
attendance.
अटेंडन्स आपण नंतर घेऊ.
Okay, no problem.
Madam, I can proceeding.
Yes,
Madam, I can proceeding.
sir, you can.
Okay, thank you. Welcome to Dr. Vinayak Khedkar. Dr. Khedkar is a UG and PG from KEM Hospital, Mumbai. He has about 27-year experience in private practitioner. Area of interest is high risk pregnancy and infertility. He is also working as a chairperson on FOGI from academic year 2012 to 14. He is also working as a president and secretary of AOGS. He is also working as a organizing secretary on AMOGS from 2009. He is also working as a peer review FOGA SI journal, member of Young Talent Search Committee, Food and Drug, Adolescent Health, Imaging and HIV committees. Dr. Khedkar has some hobbies. Example of this: acting, singing, traveling, yoga, etc. So now I request to Dr. Vinayak Khedkar, please proceeding on that occasion.
Hello,
Please
good
guide
afternoon.
us, Dr. Vinayak Khedkar.
Yes, thanks a lot. Thanks a lot, all the dignitaries and stalwarts and the professors. I would like to really say thanks to Dr. Suresh Patil sir for giving me this opportunity. And I was really wondering, like, what am I going to say for 90 minutes to all these stalwarts? And especially, I'm not from any social background. I'm not from any academic, artistic or arts background. So what am I supposed to say? I'm just a specialist. I'm a gynecologist. I work day in and out with women's health and women's empowerment. So what I was going to do, like, so I asked Dr. Arif also. He said, whatever you want to say, you say it. Then I was wondering, maybe like you, it's like a admiration, or it's like a testing period for you all, because you are going to give lectures to all other students for maybe 1.5 hours and maybe 2 hours. So even you are supposed to test how how to keep the patients listening to such a long lectures. And that's the reason they might be trying with all variety of faculties. But then in a way it's good, like so today I was, while thinking yesterday what I was going to talk, which topic I should talk, being a gynecologist, what then various topics came into my mind, like maybe infertility, maybe obesity, maybe gestational diabetes, maybe sexual education, maybe vaccines, maybe cancers. Then I understood one thing: these all fields, everybody doesn't experience these things. So what should be the topic which everyone can experience? Then I understood it's a delivery. Each and every house must have experience. आज काय मैत्रिणीची डिलिव्हरी झाली, आज बायकोची झाली, आज ताईची झाली, बहिणीची झाली, सुनेची झाली. You people must be experiencing that you have been called, तिला बाळ झालं, तिला मुलगा झाला. At the same time, they must be telling की तिच्यात फार ब्लिडिंग झाली, गुंतागुंत झाली, आणि she needed blood for that. Confirm your speaking language. What is it? Save. Okay. Something is coming in between. So then I decided, let's talk about the PPH. What is PPH? Anybody knows what is PPH? No. So it's a postpartum hemorrhage. Short form is PPH. What is postpartum hemorrhage? Everybody must be knowing. Hemorrhage is the bleeding.
After delivery consequences.
Perfect. Very good. What's your name?
Dr. Seema Dage.
Dr. Seema madam, good. So you rightly pointed out, it's a bleeding after the delivery. So it's called PPH, postpartum hemorrhage. And why it is important? Do you know?
It will create weakness among the women.
Yes.
That's why. And people are
Perfect.
not aware about it because
Ah.
everybody knows that it is normal to have bleeding after the delivery.
That's a very valid point. She said that everybody assumes bleeding to hone wala hai. There is a delivery, she is going to bleed, and that bleeding is normal. But what is normal? What is abnormal? And when these limits are crossed and what happens after that? That is the important thing. Because in India, and not only in India, all over the world, the PPH is the highest cause of maternal mortality. Now, what is maternal? It's a mother, related to the mother. And mortality means death. So, highest death, percentage of the deaths during pregnancy is because of the PPH, postpartum hemorrhage. So now, let's see how the PPH takes place. What are the reasons? What is PPH? As you said, what is normal bleeding? What is abnormal bleeding? Then what are the various methods to tackle? Can we predict? What are the risk factors? What should be done immediately? What is the types of PPH? What is the immediate treatment, later treatment? And how will you tackle this situation? So let's go ahead. I'll share my presentation with you all. Yeah. Can you see my screen? The heading of the PPT?
Yes.
Sir,
Yes.
Yeah,
you
good.
can expand, sir, if you want. You can
Yes.
expand.
I have
With the
expanded,
F5 key.
I
Slide.
have expanded from my side.
Full screen, it is also
Screen.
better.
स्लाइड शो ऑप्शन आहे ना सर वरती, तिथे तुम्ही F5 किंवा F5 देऊन सुद्धा करू शकता. स्टार्ट फ्रॉम बिगिनिंग करून.
Slide control.
ठीक आहे, दिसतं तर आहे सर, काही प्रॉब्लेम नाही.
नाही पण ते पूर्ण दिसलं तर मजा येईल.
हो, नुसतं F5 क्लिक केलं किंवा स्लाइड शो वरती तुम्ही, हा बरोबर आलात तुम्ही, तिथे जर केलं बिगिनिंग पासून तर होईल.
पण मला इथे फुल दिसतंय ऍक्च्युली.
हो का? मग ठीक आहे, असू द्या मग.
एनिवेज तुम्ही एक स्लाइड मूव्ह करून बघतो. जर मूव्ह झाली तर कॅन यू सी माय इंट्रोडक्टरी स्लाइड? डॉक्टर विनायक खेडकर, चेअरपर्सन.
येस सर, येस सर.
अच्छा,
वी कॅन सी इट.
काय अडचण नाही मॅडम, असू द्या.
आता हे दिसतंय
हो हो, दिसतंय.
मोहम्मद फताउल्लाचं स्लाइड आहे ही.
नाही,
नाही,
फर्स्ट
ती नाही
स्लाइड दिसतीये.
अच्छा, फर्स्ट दिसतंय. सो ते मग हे नाही झालं. आय शेअर अगेन.
तुमच्या नावावाली दिसते बघा.
फक्त माझ्या नावाचं पहिली स्लाइड दिसते अजून.
हा, पहिली स्लाइड.
पेशंट विथ पीपीएच आणि नाव.
हा, एक मिनिट. I'll stop and I'll again share. आता दिसतंय काही?
हो सर.
येस सर, दिसतं सर आता.
येस.
ताजमहल दिसला आता?
हो हो हो.
Okay, so good. So he's Mr. Mohammad Fataullah. Can you see his photo? Yeah, good. So that means we are on right track now. Sorry for the delay. You can stop me whenever you get bored or whenever our time ends. You can just tell me, sir, we are overshooting the time. What he said, women are not dying because of the diseases we cannot treat. म्हणजे वुमन ते मरत नाहीयेत यासाठी मरत नाहीयेत की आपल्याला त्यांना त्यांचे डिसीज ट्रीट नाही करता येते, बट They are dying because societies have yet to make the decision that their lives are worth saving. What a beautiful and important landmark statement what he has done. Because we, it's still a male-dominated society, and we haven't still understood how important these women are, how important these mothers are, and how we are supposed to take their health in consideration. Everybody knows about Taj Mahal. What is Taj Mahal? Is one of the 7 wonders. पण ते कशाचं प्रतीक आहे? कुणी सांगतं मला? Anyone?
प्रेमाचं.
प्रेमाचं. Excellent, excellent. अजून कसलं आहे?
Symbol of Mughal horticulture.
Excellent.
जगातल्या 7व्या आश्चर्यापैकी एक आहे.
फर्स्ट क्लास. परफेक्ट. परफेक्ट. आणि संगमरवरी इतका संगमरवर वापरला आणि it's a beautiful monument. It's really one of the 7 wonders of the world. But at the same time, it is just not the monument of the love. It is wrong. It's a monument of sadness. It's a monument of the death. It's a Queen Mumtaz who died in her childbirth. And then in her memory, her husband, Shah Jahan Emperor, in a grim reminder, he built this monument. So during delivery, during her 7th delivery, to be exact, Queen Mumtaz
हिंदी
died.
में बात करो सर.
Everybody is comfortable in Hindi or Marathi, whatever.
Okay.
हिंदी और इंग्लिश सर.
Bilingual, sir.
सर हिंदी और इंग्लिश सर.
Okay. So we'll talk in English and sometimes I'll clarify in Hindi. So she died in pregnancy during delivery. It was her 7th delivery. And why she died? She died because of the PPH, postpartum hemorrhage. Because it was her 7th delivery. And the uterus didn't contract and she kept on bleeding. And there were no facilities that time. And she died because of the excessive blood loss. So Taj Mahal is the not only monument of love, it's a monument of indicator that even queen can die because of the PPH. So what is the magnitude of this problem? As I said, worldwide, it is the highest death-taking problem. So according to WHO, more than 60% of maternal deaths occur in the postpartum period, whenever the prevention strategies are often lacking. Almost 5 lakh maternal deaths, they are due to the complications of pregnancy and childbirth every year. And almost 14 million cases of PPH occur every year. So this, if you come to know, what are the causes? Now in this cycle, you can understand the red zone is with the causes related to the hemorrhage. They are 38%. Blue zone is of sepsis, so infection. So infection occurring during pregnancy and thereby the deaths are occurring, it is 11%. Then hypertension during pregnancy, the BP rises, there can be convulsions, it is called as pre-eclampsia, eclampsia, झटके येतात, ऐसे tremors आते हैं, convulsions आते हैं pregnant lady को, that is because of the hypertension, because of the increased blood pressure. Then there is a obstructed labor. Those chances are of 5% because the delivery is not taking smoothly. The baby may be transverse, the baby may be with a large size baby head, asynclitic head, or hand presentation or breech, that is leg presentation. In such cases, the normal delivery cannot take place. There is a obstruction to the delivery, and then the uterus ruptures and the mother dies. Then the deaths because of abortions. They can be illegal abortions, they can be legal abortions. Today, we are not going to discuss about the abortions, but that magnitude is also almost 8%. And other conditions related to her health, then medical disorders, then nutrition, then other allergies, anomalies, they are also accounting up to 34%. So major chunk is because of the hemorrhage. So how one can understand? Even if one plane dashes, the last week, just when the Trump was sworn in, and the very next day, one small plane crashed. almost killing 77 passengers within it. But this magnitude of PPH killing the mothers, it is like 150,000 women per year. That means almost 600 fully filled jumbo jets crashing every year. Now you can understand, even if one accident takes place of one plane, it is so dangerous. Everybody is like, oh my God, why this happened? So imagine 600 jumbo jets crashing per year. Such a magnitude is there in India. So still we are supposed to control it. And that's the reason I have decided to talk on this problem, PPH. So most of the deaths, they occur within first 7 days of childbirth. And of that, 88%, they die within first 4 hours. If she has delivered in the morning, everybody is happy. Everybody is saying, wow, baby ho gaya, bacha ho gaya, ladka ho gaya, sweets bata rahe, mithai bata rahe. And nobody is bothered that she's bleeding. She's bleeding silently. And within 4 hours, she'll die. So such cases are almost 88%. So let's see what are the causes. Why the death occurs? There are 3 delays in this. Anything, whenever you delay in something, then there will be consequences of that. Same thing happens here. So what are the 3 delays? First delay is deciding that there is a problem. You don't understand. You will say, as everybody says, bleeding to hone wala hai. It's a normal bleeding. So you are not understanding. You are not coming to know that there is a problem. She's bleeding heavily. She's bleeding more than normal. So there is delay in deciding that there is a problem. Then, even if you decide, if she has decided she is living in any village, then she cannot be treated in the village. She has to come back to some hospital. Then in the transport, there will be delay. So second delay is delay in reaching the hospital. Then there is a third delay. What is third delay? Delay in initiating the appropriate care. See, the patient reaches hospital, but then doctor may not be there, sisters may not be there. If it is a night time, everybody is sleeping. So there will be delay. And again, after reaching the hospital, the proper drugs may not be there, proper medicines, or if she needs any operation, the surgeons, the anesthetists, the blood, those facilities may not be there at 11th hour of the time. And then there will be delay in starting the proper treatment. So these are the 3 delays which basically kill this mother who's already landed in PPH. So what is PPH? As I'm telling you, the textbook definition is more than 500 ml in the case of vaginal delivery, what we call it as normal delivery. Any normal delivery, any vaginal delivery, as Dr. Seema said, there will be bleeding. Yes, absolutely. But the bleeding will be up to 500 ml in a vaginal delivery. That's a normal delivery. And if it's a cesarean operation, cesarean delivery, then 1 liter, up to 1 liter is a normal bleeding of all the patients. Sorry. So whenever in the case of vaginal delivery, if bleeding is more than 500 ml, or in case of cesarean section, if the bleeding is more than 100 ml, then it's a PPH. Or whenever the patient deteriorates and she needs blood transfusion, it's a PPH. Or if there is a 10% drop in hemoglobin. Everybody knows hemoglobin. What is the normal hemoglobin? Anyone?
I think 13 is range for
Yes.
women.
Sir,
Perfect.
8
Up to
8 to
16
11.
or
No. For women, it is 12 to 14, normal range. And for men, it is 13 to 15, normal range. Anything less than that is called anemia. Anything, and if it is less than 10, it will be divided like mild, moderate, and severe anemia. So anything less than 10 is 10 to 8 is mild, 8 to 7 is moderate. Anything less than 7 is severe anemia. So if there is a 10% drop in hemoglobin, initially, suppose if that lady was having hemoglobin of 12, and now it is dropped by 1.2. So she is almost like 10.8. So you may say that 10.8 is okay, but then she has dropped by 10%. That means she has bled a lot. That means she has suffered a PPH. So 10% drop in hemoglobin. or any amount of blood loss after delivery which alters the vital parameters. What are the vital parameters? We say pulse, BP and respiration. Anybody, what is the normal pulse rate? अपनी नाड़ी कौन से रेट से चलता है? अपना हार्ट रेट कितना रहता है नॉर्मल? Anyone? Any guess? You can say any figure. नॉर्मल पल्स कितना रहता है? खुद का
70
देखो
70
कितना?
80 120 असं काहीतरी
Yes. Perfect. Around 80. That is the thing. So 80 to 100 is the range. Anything, whenever it crosses 100, you are alert. That means something is going wrong. So the causes of high pulse rate is with the temperature, whenever the fever is there, or bleeding or dehydration. Then the pulse rate will rise. So anything more than 100, there is a early tachycardia, more than 120, late tachycardia. And if it is more than that, then it's a dangerous situation. I'll come to that later. And BP, what is the normal BP?
60, 120.
Yes. 120 to 120 is the systolic, that is the upper blood pressure, and 80 is the diastolic, that is the lower blood pressure. That is the around the normal things. But then up to 140, so 120 to 110 to 140 is the upper limit, and say 60 to 80 is the lower limit. Perfectly right. Dr. Savita madam said, I suppose. So good.
Yes, sir.
Everybody knows. Yes. And what is our respiration rate? Anybody knows? कौन से स्पीड से अपन सांस लेते हैं? 1 मिनट में कितने बार सांस लेते हैं जो नॉर्मल है, और कौन सा एबनॉर्मल है? Anyone?
72 times. 70.
72
times. 72, it is a heartbeat time.
Yes, 72 is the heartbeat. रेस्पिरेशन, हम जो सांस ले रहे हैं 1 मिनट में हम लोग ज्यादा से ज्यादा 20 बार सांस लेते हैं जब नॉर्मल कंडीशन में रहते हैं. Whenever we respire more, if the respiratory rate is 30 per minute, that means we are already tachypneic. It's called a tachypnea. हम ज्यादा स्पीड से सांस ले रहे हैं, इसका मतलब हम थक गए हैं, हमको ऑक्सीजन की जरूरत है, अपना ऑक्सीजन कम हो रहा है, अपने ब्रेन को जो whatever oxygen is getting delivered to the brain is less, and it may be because of the bleeding, it may be because of the anemia, it may be because of the high altitude. ज्यादा हाइट पे चले गए तो ऑक्सीजन सैचुरेशन कम होता है, तो अपने को दम लगता है, इसलिए और यू मे एक्सर्ट, रन करके आए, दौड़ के आए, सीढ़ियां जोर से चढ़ के आए, दम लगेगा, बिकॉज दैट टाइम द ऑक्सीजन इज रिक्वायर्ड इन मोर क्वांटिटी, एंड टू फुलफिल दैट डिमांड our heartbeats also increased and our respiration also increased. But if during delivery, if the mother starts respiring more than 30 per minute, that means she is landing with the hemorrhage. Her hemoglobin is going down. That's the reason her oxygen is delivered less and she requires more oxygen. That's the reason she is taking more respiration. Now, why this was important? It was important for the relatives, not for the doctors. It was important for the relatives who are sitting around that lady, that mother. अरे दिख रहा है सामने, वो पेशेंट गैस्प कर रही है, वो पेशेंट ब्लीड हो रही है, नीचे तो कोई देखेगा नहीं immediately. They are not going to see their pads, but then these are the external parameters which you can see. डॉक्टर देखो पेशेंट कैसा कर रहा है, पेशेंट ज्यादा स्पीड से सांस ले रहा है, and then everybody will start moving. So this is the good point, and one should understand that she is landing in trouble. So as per the WHO definition, any blood loss from the genital tract during delivery more than 500 ml in the vaginal delivery and more than 1 liter in the cesarean section. Or as per the American College of Gynecologists Association, the decline in hematocrit means HB by 10% or need of RBC transfusion is called as postpartum hemorrhage. So how will you classify? As I said, uske type consequence hai. It is primary and secondary. Primary will be within first 24 hours and secondary up to 12 weeks. 12 weeks means up to almost 3 months. So agar 3 महीने तक भी bleeding होती है, it is be again called as PPH, but it will be called as secondary PPH. And most of the times it is because of the infection or retained placental tissue. Placenta, everybody knows what is placenta? Placenta, jahan
Connection between the unborn baby and the mother.
Yes, perfect. It is that spongy umbrella-like thing which is formed inside the uterus. It's from the maternal side, and there is a cord which connects the baby through the umbilicus, and the blood transport takes place. The oxygen is transferred through that. So oxygen and calories and sugars and everything is transferred from the placenta through the umbilical cord to the baby. So if during delivery the baby comes out, but then part of placenta remains inside, it will get infected. So that's a reason it is called as retained placental tissues. And that is most of the times cause of the secondary PPH. Now, what are the risk factors? Can you guess कि इसको अगर ऐसा है तो she is the most likely candidate to go in PPH. Now, as I said, ये मुमताज रानी को कुछ कम था क्या? नहीं, फिर भी उसको हो गया, लेकिन उसको एक रिस्क फैक्टर था. कौन सा था वो? मैंने पहले ही बताया. उसका डिलीवरी का टाइम कौन सा था? वो कितनी बार वो प्रेग्नेंट थी? She was pregnant 7th time. Yeah. So there were multiple deliveries before that. Now that is one of the risk factors. इसीलिए nowadays we don't advise more than 2. Because more than 2, the uterus becomes little weak. She is also, after stress of delivery, she is also anemic. HB is less, infections are more. So that is one of the risk factors. Then what are the other risk factors? Pre-eclampsia, whenever the BP rises of the patients, or previous history of postpartum. अगर पहले delivery में हो गया है bleeding ज़्यादा, तो that is also risk factor. Multiple gestation यानी twins, triplet. Nowadays, with the IVF pregnancies or with the infertility treatment, we give injections. So multiple eggs are formed. When the multiple eggs are formed, there are chances of multiple pregnancies. So, agar twins bhi hai, she is a likely candidate to go in the PPH. Now, previous cesarean section, that is also cause of the PPH. Then multiparity, as I already said. But then more than that, any patient, because most of the times what we are seeing, the patients who are landed with the serious postpartum hemorrhage didn't have any risk factor. So any patient for that matter can land up in postpartum hemorrhage. That's the reason we should be always aware of these clinical conditions and the treatment part. And everybody, all the women, all the gents, they should understand this topic very well. It is not just a gynecological obstetrician or from my point of view, important topic. It's a day-to-day topic. Any time in your life, you're going to come across anyone who is delivering, and you may be around there, and you can, after listening to this lecture, you can predict some things, you can observe some things, you can alarm that patient, the doctor, the sister, and that patient's life will be saved. From that point of view, it is important. Now, intrapartum risk factors. What I said were the antepartum risk factors. What are the intrapartum? What is the anti means before delivery. Intrapartum means during delivery. So during delivery, prolonged third stage. Now there are stages of delivery. First stage means the cervix starts getting dilated. बच्चादानी जो रहती है, उसका मुंह जो रहता है वो थोड़ा ओपन होना शुरू करता है. That is the first stage. जब वो fully open होता है, that is 10 centimeter. That is second stage. Now from that time, the baby delivers, and from baby delivers to the placenta delivery, that is the third stage. So prolonged third stage, baby deliver हो गया लेकिन placenta बाहर नहीं आई है. So that is called a prolonged third stage. Whenever it takes more than 30 minutes, there will be chances of PPH. Now, mediolateral episiotomy. Episiotomy means during delivery, vaginal delivery, to facilitate the delivery, we cut the lower area. It is called as episiotomies, to increase the outlet diameter so that the head can come out easily. So it is a sort of a cutting. Now, mediolateral episiotomy also causes more bleeding. Now, midline episiotomy, because it can extend posteriorly through the rectus, anus, and it can cause more bleeding. Then arrest of descent. Arrest of descent means the बच्चे का head नीचे नहीं आ रहा है, वो अटक गया बीच में, तो उससे trauma हो जाएगा अंदर, and because of that there will be lacerations and there will be bleeding. Now there will be augmented labor. What is augmented? Augmentations means to increase the speed. So अगर first time delivery के लिए है patient, she will take minimum maybe say 7 hours to 24 hours to deliver. And in case of multi, like second time delivery, she'll take any time in between 5 to 10 hours. Within that time, she will deliver. So अगर उससे ज्यादा टाइम लग रहा है और उससे फास्ट टाइम हो गया कभी भी, अगर she delivers within 2 hours, that means what will happen? The baby will come out so fast, it will tear it off. All there will be lacerations, tear in the birth canal, birth passage. Or you are using the forceps delivery, that time also it will cause the trauma and the causes of the postpartum hemorrhage. So we remember in exam or during our wards also, if the patient lands up in 4 pph, the causes are 4 T's. 4 T. First T is tone, that is uterine tone. The tone means how hard is uterus. Uterus is soft or hard, or it's in between. So the tone is very, very, very important. In fact, majority of problems are because of this tone. And I'm going to discuss the management also on that thing. So tone, everybody should remember. It's not the vocal tone. It's the tone of the uterus. बच्चा देने का tone बिल्कुल एकदम hard पत्थर जैसा हो जाता है uterus. And that is the good indication that uterus is contracted and she will not land up in PPH. Now, what is the second cause? Is the tissue. So retained tissue, as I said, placenta. अगर कुछ भी उसका टुकड़ा अंदर रह जाता है तो उसका इन्फेक्शन होगा, that will be another cause. और उसकी वजह से वो यूट्रस कॉन्ट्रैक्ट नहीं होगा, उसका टोन नहीं बढ़ेगा. सो टिश्यू. थर्ड इज ट्रॉमा. तो बच्चा नीचे आते वक्त अगर फट गई, vagina is torn or the uterus is torn, then the trauma also can cause more bleeding. And then thrombin. Thrombin is a mechanism whereby the blood clots, coagulates. So whenever there is a thrombin disorder, there is a bleeding disorder, the blood doesn't coagulate. अगर अपने को कुछ लगता है, within पहले तो 2 मिनट के लिए ब्लीडिंग होगा, लेकिन 2 मिनट के अंदर वहां पे क्लॉट बन जाएंगी और ब्लीडिंग विल बी स्टॉप. ऐसा नहीं होगा तो we all will be suffering because of the hemorrhage. The same thing, like if there is a problem of coagulation, that patient can land up with PPH. So it's very easy. In fact, many physicians also miss many a times, 50% of the times, and that slow trickles, slowly, as I said, everybody is happy and she's bleeding. So after 4 hours, she'll die. So most of the times, once patient delivers, the doctor is tired, the sisters are enjoying, they are having tea, coffee, relatives are also enjoying, they are giving focus to the baby. Nobody gives attention to the patient and she will die within 4 hours. Or inside bleeding, abdominal bleeding or pelvic bleeding may be missed. So you are always supposed to see for the signs of bleeding. You are supposed to calculate the blood loss properly, evaluate bleedings or slow bleedings, and if mother develops hypotension, tachycardia or pain, you are supposed to rule out the intra-abdominal blood loss. What is hypotension? Is related to the blood pressure. Whenever the blood pressure falls, it is called hypotension, and whenever it is rises, it is called hypertension. So how will you manage? Now you are diagnosed. How will you manage the PPH? So it's a team effort. As I always say, it doesn't give you much time because she is bleeding. By the time you come to know she is bleeding, she has landed in severe trouble. She has already lost blood. She's already sinking. And then you are supposed to react fast. So it's not a one-man show. You are not a hero. Yes, I'll do everything. No. You need a team. You are supposed to call for help. Team of obstetricians, that doctors like us, team of anesthetists, भूल देने वाले डॉक्टर सबको पता है. Hematologist, अगर बहुत ज्यादा ब्लीडिंग हुई है तो ब्लड देना पड़ेगा, तो hematologist and blood bank. The blood bank should be there nearby. You should send the sample of the patient in a plain bulb. In fact, before doing each and every operation, It may be cesarean operation, it may be neither operation. We send patients blood. You must have noticed that doctor आपको patient का blood निकाल के दे रहे हैं, बोल रहे हैं कि जाओ blood bank और blood reserve करके आओ. बोलेंगे क्यों चाहिए, क्या जब blood लगेगा देखेंगे ना? No, it wastes a valuable time. अगर तुम लास्ट मोमेंट पे भागदौड़ करने गए तो दैट्स द रीजन वी गिव ब्लड इन अ प्लेन बल्ब वेयर द blood bank is cross matched with the patient's blood and the compatible means जो blood वो patient को चलता है, that bag is kept reserved for that patient. And all these blood banks like here the Taji Bhale, they to use their NAT, that is NAT amplified blood. It's a very good wonderful quality blood, and they keep it reserved for 3 days for that patient. So if it is needed in emergency, you can get the blood within 10 to 15 minutes. So that is the reason we keep blood cross-match for every operations. Now correction of hypovolemia is needed. Hypovolemia means volume kam ho gaya. Kaun sa volume? Blood volume, because of the bleeding. And then you're supposed to ascertain origin of the bleeding. Keep bleeding from where the bleeding has started. You're supposed to find out that whether from the 40s, kaun sa T hai, you are supposed to ascertain the origin. Then you ensure uterine contractions. If the uterus is contracted or not properly, उसका एक पत्थर जैसा गोला हो गया कि नहीं है, ऊपर से पेट पे हाथ लगाने के बाद समझता है कि अरे uterus is contracted nicely. If you happen to visit in a hospital and just now a patient is delivered normally, scissor वाली तो हाथ लगाने नहीं देगी because there will be a scar. लेकिन अगर normal delivery हुई है, just उसके पेट के ऊपर हाथ रख के देखो, it is really like a rock. पत्थर जैसा हार्ड रहता है. So that is the good contracted uterus. And then surgical management in the special situation that we are going to see later. So how to ascertain कि कितना blood loss होने के बाद क्या क्या होता है, will come to know this. In case of normal delivery, the estimated blood loss is only less than 500, and that is less than 10% blood volume loss. And there won't be any signs or symptoms, so no treatment is needed. As Dr. Seema said, this is expected and nothing happens. But the moment the blood loss is more, that is 500 to 1 liter, the blood loss is 15%, and there will be minimal symptoms. So you are supposed to observe and you are supposed to take a reaction or replacement theory. But whenever the blood loss is more than 1200, almost 1.5 liter, then the loss is 20 to 25%. And then the patient will start showing symptoms like decreased urine output, increased pulse rate, increased respiratory rate, postural hypotension. What is that means? Postural means the patient gets up from the bed and she'll feel giddy. चक्कर आ रही है, अंधेरा आ रहा है, जैसे वो बेड से उठती है. That is called postural hypotension. So that means she has already lost 20 to 25% of blood during that period. So you are supposed to take an action. This is the action time. And whenever the blood loss is more than that, up to almost 2 liters, then almost 33% blood volume is lost. There will be hypotension, BP बहुत ज़्यादा गिरा है, tachycardia, pulse rate is more than 120, cold clammy extremities, यानी ठंडे हो जाते बिल्कुल हाथ पैर, और tachypnea, सांस लगती है, सांस बहुत ज़्यादा रेट से होती है. In that time, you are supposed to do urgent action. And ये cold clammy क्यों होते हैं हाथ पैर? Because the blood pressure has fallen. Now we have got some vital organs. Whenever the BP drops, our brain is the first thing the body always try to protect. We have got 4 major organs: brain, heart, kidneys, and lungs. So if they don't get blood supply, they don't get oxygen, then there will be a problem. So first important, that brain doesn't get oxygen for 3 minutes, there will be cerebral hypoxia. That patient will land up with the hypoxial damage to the brain. There will be a permanent damage. And after that, they will die. There will be brain death. That patient will die. So the most important thing, other organs, they can take over a little more time. But then brain is such an organ that you need to act within 3 minutes. That's the reason now what body does whenever the blood pressure drops, it cuts down. बजट कैसा करते हैं अपन कि महीने के आखिर में शुरू तो हर जगह उड़ाते हैं सबको जाओ पार्टी करो पिक्चर देखो मॉल जाओ शॉपिंग करो everywhere. So we are spending money like anything. But then as the month end approaches, now कड़की तो है अभी जरा संभाल के ना मूवी नहीं जाएंगे शॉपिंग नहीं करेंगे. So you are cutting down that budget from those areas which are not so important. Same thing happens when the BP drops. Blood flow is maintained to brain, kidneys, heart, lungs and liver. तो इसलिए हाथ पैर का ब्लड फ्लो जो है वो कम किया जाता है. कैसे कम किया जाता है? The blood vessels they contract, they constrict, and as soon as the blood vessels constrict, the oxygen is reduced. Oxygen supply to these instruments are reduced. तो इसलिए वो ठंडे हो जाते हैं. Blood गर्म रहता है. Everybody knows. Because of that we are warm. We are warm blooded. But then as soon as वहाँ का blood flow कम हो गया ये ठंडे हो जाते. So whenever you are seeing any person जिसके हाथ पैर एकदम ठंडे हैं तो you should suspect अरे इसको कुछ प्रॉब्लम इसका बीपी कम है शायद. So this is the way you should understand how the things are going wrong. Now if she bleeds more than say 2.5 liters, she'll go in shock. She will just collapse. She'll be unconscious. And that time is the time when you are supposed to just run, pick her up, run. Or if you are in the hospital, just press a code blue. That is emergency management. So how will you assess? Initial assessment is very important. Identify possible postpartum hemorrhage and you are supposed to see, अरे सच में उसको ब्लीडिंग ही हुई है ना कि वो अस्थमेटिक है और उसका पंप नहीं मिला उसको और कुछ इंजेक्शन दिए गए उसकी वजह से ब्रोंकियल अस्थमा हो गया उसका एक्सैजरेट उसके वजह से उसको ये प्रॉब्लम है. So you are supposed to differentiate because the treatment management is different for bronchial asthma and for postpartum hemorrhage. What is more dangerous? Both are dangerous, obviously. But then postpartum hemorrhage, because she is continuously bleeding, that is most important. Simultaneous evaluation and treatment. And remember ABC. What is ABC in our language? Airway, breathing, and circulation. So you are supposed to take care of airway. Whenever the patient collapses, shock में जाता है, उसको convulsions आते हैं या बेहोश हो जाता है, what happens? The tongue it falls, पीछे आ जाती है, and that blocks the airway. Those people who have got the habit of snoring, बहुत जन स्नोर करते होंगे, लेकिन उनके हस्बैंड को और वाइफ को पता ही रहता है उनको कि अरे अपना हस्बैंड या अपनी बीवी स्नोर करती है, खुद को नहीं पता चलता है. क्यों? बिकॉज वो टाइम पे सोए हुए रहते हैं. But then whenever we sleep, this tongue, it falls on the trachea or a partially blockage हो जाता है. And that's the cause of the snoring. So in fact, there is various treatment also modalities available to avoid that snoring, which we'll discuss later if we get a chance. But then what you should remember that whenever the patient is unconscious or collapsed, you should see to it, you will turn her head on one side so that the tongue may not fall on the trachea and block the airway. So airway is the first thing. Then breathing. She should breathe. If she doesn't breathe, she will die because within 3 minutes, the baby, the brain won't get an oxygen. So you are supposed to give artificial mouth-to-mouth respiration. Or there is... Hello? Any problem?
No, sir.
Okay.
चुकून सुरू राहिलं होतं त्यांचं.
Okay, no problem. So you are supposed to give a mouth-to-mouth respiration, but nowadays, many times there is an ambu bag. There is a, so you can keep it a bag and open the mouth and press and release and press and release. That will cause an artificial respiration. Or the patient can be put on the ventilator also. And circulation means the heart also should run. It's not only respiration. The heart should pump. The heart should beat minimum 60 to 70 times a minute. If it doesn't beat, then the oxygen won't be there to the brain. For that, you are supposed to give the injections or you are supposed to do CPR, cardiopulmonary resuscitation. You are supposed to press on the thorax There are various courses available to conduct CPR because nowadays anybody can collapse. Post-COVID, there are so many young boys, like they are running, they are playing cricket, or they may be just climbing stairs and they will collapse. Now, if you know how to give CPR, you can save that person's life, you know. So that thoracic compression just above the heart, it is on the just in the midline, little left side, and the fourth intercostal space, and you can keep on giving pressure and releasing them. It will cause compression of the heart in a rhythmic manner. That by giving the artificial blood supply. So that is ABC. Use of oxygen. Of course, that patient requires oxygen. Everything is run because of the oxygen. The basic fuel of brain is oxygen. If the brain doesn't get oxygen, kidneys doesn't get oxygen, they will stop working. So you are supposed to put on the oxygen. So that for that, of course, the patient should be in the ICU for that matter in such cases. Now, if the bleeding doesn't stop, you are supposed to call for more help. Ask for the surgeons, other obstetricians, your senior friends, you can call them. Then start another IV line. You are starting, most of the times you are seeing there are either blue venflons or pink venflons. You must be saying, I want a pink one. I'm not going to start a green one. No, they are just color given for the sisters, for the staff to understand what is the gauze. The green one is the 18 number. 18 number is bigger than 20 number. Here it's like the number is 1 divided by that number is the diameter of that cannula. So 22 number is still laser. So 22 number is the blue one, which we start to small girls, small boys, then pink ones, that is 22 number for the adults. And whenever such cases, like emergency cases, we start either green colored, that is 18 number, or 16 number. 16 is more bigger than the 18 number cannula. And within, say, 1 minute, they can deliver half a liter of fluid. So whenever there is a majority problem is because of the tone. So we call it as uterine atony, and almost 70% of the time it is because of the uterine atony. Now you're supposed to assess and treat that uterine massage. How we do any massage? Everybody must have taken massage. पूरा बदन प्रेस करते हैं, है ना? सर को भी प्रेस करते हैं, अच्छा लगता है. देखो, मदर ने किया, बहुत अच्छा लगता था. बीवी भी करती है, बहुत अच्छा लगता है. You feel so nice. Or if you are not getting it done from them, you go in a spa, you spend money and get the massage done. And then you will feel better. Why better? Because by pressing those muscles, the stagnated blood, which is having less oxygen, is pumped out of that muscle, thereby giving the space to get a new blood which is having more oxygen. Now that less oxygen blood was causing you tiredness, fatigability. Now the new blood comes with more oxygen, you will feel fresh. That's the reason you feel fresh whenever you are getting the massages done. So same thing, you are supposed to do the massage. Now this massage of the uterus is not only for that to get the new blood. The massage is to stimulate the uterus to contract also. Because then it will start contracting. That is the reason it is very important. Then you should use medication early and consider prophylactic medication. Which are they? I'll come to you in a little time. Now, what is uterine massage called as? It's called as bimanual uterine exam. Now, what is bimanual? Means the one hand is kept on the patient's abdomen, another hand is kept inside the vagina and then you hold the uterus in between the two hands, and thereby you assess whether the uterus patthar jaisa hua hai ki nahi, whether it is contracted hard hai ki nahi. That is most important. If it is hard, then cause is not the uterine atony. It is not because of the tone. It has to be something else. So you are diagnosing and ruling out. At the same time, you are treating. How? If it is soft, the uterus is soft, dab raha hai achhe se, then you give her massage. You keep on massaging from abdomen and at the same time stabilizing through inside. Because of that, then the uterus will start contracting. Most of the times, that is the only treatment needed, and it starts a contraction. Now, what is the fluid resuscitation? The same time, you are supposed to maintain the tissue perfusion by giving salines with the large bore IV access. Then there are crystalloids, colloids, blood products to maintain the HB 10 grams. हम जो सलाइन चढ़ाते हैं, सलाइन के प्रकार पता है आपको? किसी को पता है? By any chance, what are the salines? Anyone?
लाइन पता है सर, लेकिन उसके टाइप्स नहीं पता.
Okay, okay, very good, very good. सलाइन
कुछ कुछ छोटे ही होते, वो इंजेक्शन होते हैं.
हाँ 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 हाँ, perfect.
सर डिफरेंट डायरेक्शन में देते हैं. मींस 45 एंगल, 50 एंगल एंड लेस देन 45 एंगल, ऐसे कुछ देते.
Okay, okay. So, जो variety of salines are there. Now, there are salines like ringer lactate. Coconut water देखा है? Coconut water का जो composition है, that is ringer lactate. इसीलिए वो जैकी चैन की एक मूवी में दिखाया सीधा, उसने कोकोनट में सुई डाला, एक नली निकाली और पेशेंट को लगा दी, उसकी गर्लफ्रेंड को. They are great. Hollywood producers are great. They will utilize everything. And then I was wondering how great they studied so much, because the ringer lactate saline is same as that of coconut water. It's having everything. Then there is one dextrose normal saline. Dextrose, as the name suggests, it's a glucose. It's a sort of a glucose. So it contains sweet, it contains calories in the normal saline. And there is a third saline, it's a normal saline only. There is no dextrose in that. And it is very much useful in the diabetic patients. So whenever you tell, no, my mother is diabetic, और डॉक्टर ने सलाइन चढ़ाया, देख लो कौन सा चढ़ाया, वो सिर्फ NS रहता है, नॉर्मल सलाइन. उसमें ना तो DNS रहता है, ना ही रिंगर लैक्टेट रहता है. Ringer lactate only in cases of dehydration, whenever you require to maintain the potassium and sodium. That's the time you are supposed to give a ringer lactate. But then this patient is collapsing. कुछ तो दो बाबा, फटाफट दे दो, उसका BP मेंटेन रखो, कृपा करो, दे दो कुछ तो. तो दोनों साइड से you are starting the salines to keep her BP maintained, to keep her the perfusion maintained. Because once the veins collapse, once the arteries collapse, then they'll be very difficult and she'll go in irreversible shock. So you are supposed to give saline. Now what will happen? Saline will last only for some time in the blood circulation. The kidneys will filter them out and the urine will come out. So then there will be colloids. Colloids are what? They are like blood-like products. They are not blood, but they are blood-like products. The blood-like products you are supposed to give. So if the saline remains in the circulation for say half an hour, colloids will remain in circulation for 2 hours. So you are buying a time till the time you get a blood. Because ultimate, what patient is going to need is the blood. But then till the time you are supposed to maintain, किला तब तक लड़ाओ जब तक बैकअप नहीं आता है. So तब तक लड़ो is these crystalloids and colloids. Now the blood products, you are supposed to give them whenever the patient lands. And everybody knows the blood products. What are they? ब्लड कौन से प्रकार के होते हैं, टाइप के रहते हैं? एनीवन?
ए ब्लड प्लाज्मा.
वेरी गुड, एक्सीलेंट. और अभी डेंगू होता है तो क्या चढ़ाते हैं? क्या कम होता है डेंगू में?
WBC कमी होता है.
प्लेटलेट्स. प्लेटलेट्स, परफेक्ट. यस, व्हाइट सेल्स एंड प्लेटलेट्स. सो व्हाइट सेल चढ़ाते हैं जिनके, वो कम हो गए. प्लेटलेट्स सबसे ज्यादा कम होते हैं, वो इसलिए प्लेटलेट्स चढ़ाते हैं. प्लेटलेट्स के भी 2 टाइप रहते हैं, एक SDP और एक मल्टी डोनर. SDP यानी सिंगल डोनर प्लेटलेट, एक ही आदमी समझो गया ब्लड डोनेट करने को, उसका ब्लड तो लेते हैं लेकिन देयर इज वन मशीन, इट फिल्ट्रेट्स ओनली प्लेटलेट्स एंड बाकी का ब्लड वापस छोड़ देते हैं अपने शरीर में. सो उसके सिर्फ प्लेटलेट्स लिए, उससे ज्यादा प्लेटलेट मिलते हैं. So that is called SDP. It is very much needed in such cases and in dengue or in burns patients or whenever there is a lot of bleeding or coagulation disorders or DIC. Such patients require SDP. Now, ये कब तक देना है ब्लड? जब तक उसका हीमोग्लोबिन 7 से ऊपर नहीं आ जाए. Then we can tackle everything. And then you are supposed to see and tackle coagulopathy and thrombocytopenia. Thrombocytopenia means platelet बहुत कम है, उसका नाम है थ्रोम्बोसाइटोपेनिया. एंड कोएगुलोपैथी यानी ब्लड कोएगुलेट नहीं हो रहा है बराबर, से उसका नाम है. So, what is the position like? What is the benefit? The concept is whenever you are giving IV fluids, उतना प्रेशर मेंटेन रहेगा, उतना ऑक्सीजन किडनीज को भी मिलेगा, ब्रेन को तो देना ही है, लेकिन अपने को apparently will think that there is a more budget allocated right now, so let's spend on kidneys. So urine will form and there will be renal failure. So this crisis will be tackled because of this. Then a recent view concluded that Trendelenburg position is probably not a good position for resuscitation who is hypovolemic. किसी को चक्कर आते हैं तो क्या करते हैं, देखा है आपने, क्या करते हैं? अच्छा, धूप, अभी तो धूप शुरू हो गई, कोई तो चक्कर आके गिर गया, व्हाट यू डू फर्स्ट थिंग? एनीवन?
कुछ मीठा खिलाने की कोशिश करते हैं।
हाँ, कुछ शुगर।
वेरी गुड। एंड सबसे पहले जैसे मैंने बताया, चक्कर क्यों आती है? ब्रेन को ऑक्सीजन कम पड़ा, ब्रेन को ब्लड सप्लाई कम हुआ, इसलिए चक्कर आई। सो व्हाट यू आर सपोज्ड टू डू? इंक्रीज द ब्लड सप्लाई टू द ब्रेन। हाउ विल यू डू दैट? बाय लोअरिंग द हेड कंपेयर टू द लेग्स। इसलिए सुलाते हैं वो पेशेंट को, खड़े नहीं रखते। चक्कर आ रहे हैं पकड़ के खड़े हैं ऐसे, वी डोंट डू दैट। सुलाओ बाबा उसको, सुलाओ, और क्या करो, उसके पैर ऊपर ले लो। नॉट ओनली दैट, वो पैर को फोल्ड करके उसके एब्डोमेन पे, टमी पे दबाओ, सो दैट ये पैर का भी जो ब्लड सप्लाई है दैट गोज टू द ब्रेन एंड देन पेशेंट फील्स बेटर। फिर अच्छा लगा उसको, एक बार मिल गया तो बॉडी ऑल्सो टेक्स हो रहा है, वो ठीक है, टेम्पोरली हुआ था लेकिन अभी चालू करते हैं सब। देन यू गिव शुगर, परफेक्ट। अगर पेशेंट डायबिटिक है फिर भी देना है क्या शुगर?
नहीं सर,
नहीं देना। और कोई देना है?
नहीं दे सकते।
नहीं दे सकते।
No,
लेकिन पता नहीं होगा सर, मतलब इन जनरल अगर कोई पर्सन डायबिटिक है कि नहीं वो कैसे पता चलेगा? तो इन
बराबर।
जनरल पीपल विल टेक द डिसीजन, जैसे चॉकलेट दे दिया, कुछ
हाँ,
दे दिया, ऐसे हो
सर,
जाएगा।
कुछ
और
लोग
इतनी शुगर से इतना नुकसान होगा क्या सर अगर दिया तो?
सो इवन अगर पेशेंट पता ही नहीं आपको डायबिटिक है नहीं है, आपको तो देने वाले हैं। अगर आपको पता है पेशेंट डायबिटिक है, ये पर्सन डायबिटिक है, तो आप सोच में पड़ोगे देना कि नहीं देना। लेकिन इतनी सी शुगर देने से कुछ बड़ा नुकसान नहीं होगा, बिकॉज मेनी टाइम्स दीज डायबिटिक्स दे आर गिडी बिकॉज ऑफ द हाइपोग्लाइसेमिया। उनकी शुगर कम होती है, मे बी बिकॉज ऑफ द मेडिसिन, अगर कुछ खाया नहीं है या धूप की वजह से, तो उनकी शुगर कम होने से उनको चक्कर आती है। तो उनको शुगर दे दो, दे विल फील बेटर इमीडिएटली, 2 मिनट में। हाँ, कौन है रे वो, ऐसा। सो दे विल फील फ्रेश, and that is because of the sugar. So you are supposed to give any person, give sugar, chocolate, syrup, whatever. If she is diabetic and her blood pressure sugar is on higher side, 200 है, तुम दे दो, 200 के 250 हो जाएगी, लेकिन कुछ नहीं होगा पेशेंट को। यानी वो उसका वो रिकवर नहीं होगा, लेकिन डैमेज भी नहीं होगा। बट by pressing, by keeping the supine position, उसको supine position बोलते हैं हम, जब लिटाते हैं पेशेंट को, that is called a supine position. By that position we are ensuring that more blood supplies to the brain, and because of that the patient will gain the consciousness. So there is no harm in giving थोड़ा शुगर, बिल्कुल दे दो, बिंदास दे दो, कुछ प्रॉब्लम नहीं है। हो सकता है डायबिटिक भी हो लेकिन शुगर कम होने की वजह से हुआ है, एंड आफ्टर गिविंग शुगर she will get up and you everybody will say, अरे आप तो बहुत ग्रेट है, आपने बराबर पहचान लिया। So you can give, don't worry. So we were talking about the position, the Trendelenburg position. Trendelenburg is like, if you are seen like while doing abortion or while doing copper T insertion or while examining the patient, legs are hooked up on one hook. That position is called Trendelenburg position. Now, in this position, you cannot do any treatment to the patient. That's the reason it is not a comfortable position. So supine position, that is lying down position, is the best position. Just now I was talking about the bimanual uterine massage. This is a diagram. See, can you see one hand is on the abdomen. From that you are pressing the uterus from posteriorly. This is the uterus. This is the bachadani. Or another hand is inside the vagina. The whole fist is there and you are pushing up that uterus, up and posteriorly. By that you are sandwiching that uterus between the two hands and giving the contraction. It is called as bimanual uterine massage. And take it from me, 50% of the times, this is the only thing which is needed during this. So whenever you are seeing any such patients, you can advise that sister, "Arey, massage to the uterus ko," and if that sister is new, then she'll remember, "Arey, apne ko sikhaya tha," and she'll do it. So again, because of that, you will save the patient. Now, what are the medications of PPH? Now we are talking about the atonic PPH, that is to the medicines which will increase the uterine tone. Now, why that tone is important? Have you anybody thought over कि इतना सा यूट्रस रहता है, by the time 9वां महीना आ जाता है तो यहाँ तक आ जाता है, पूरा छाती के यहाँ तक, वो पूरा बच्चा अंदर रहता है, the baby is inside. Now suddenly the baby comes out. Okay. Now whole area of that uterus with that vessels inside, they are exposed. Now with that, all the vessels, they will start bleeding and the patient will die within 2 minutes. Why that doesn't happen with everyone? What is that mechanism? What is that nature जो great है, क्या करता है ऐसे? So it is because of that uterine musculature. Uterus यानी बच्चादानी muscular organ है. उसमें 2 प्रकार के मसल्स रहते हैं, एक जो सर्कुलर रहता है और दूसरा जो ट्रांसवर्स रहता है. So they form a net like this, crisscross. So the moment patient delivers, all the muscles they contract. जो सर्कुलर रहते हैं वो यूट्रस को नीचे लाते हैं और जो ट्रांसवर्स रहते हैं वो यूट्रस को बीच में लाते हैं. तो with these 2 muscles, the uterus becomes small. It reduces in height and it reduces in width, and thereby those vessels, they are caught in between, so they are like clamped. So these are natural ligatures, जैसे stitch लिया है. So ये देवता भगवान करता है ऐसा कि हर कोई मदर ना मरे, इसलिए वो यूट्रस कॉन्ट्रैक्ट होता है. All these capillaries, these vessels, blood vessels, they are like stitch, they are clamped, and then they stop bleeding, and within minutes the coagulation takes place, the clot formation takes place, and these capillaries, these blood vessels, they are shut down. So this is the basic mechanism. What happens with each and every mother. That's the reason all the mothers are saved. But some mothers are unfortunate. This contraction doesn't take place properly, and the uterus remains like this, and then she keeps on bleeding. So what are the medicines? I'm going to tell you now. Can you see this name? First name is Pitocin. Second name is Mithagin. Third is Misoprostol. Fourth is Carboprost. And then there is one latest molecule also, I'll tell you. But after finishing with these 4, what is Pitocin? Pitocin तो नाम सुना होगा. दूध कितने जन पीते हैं यहाँ पे? दूध पीते हैं? यहाँ पे कोई है ऐसा कि वो दूध नहीं पीते? हम
पीते हैं ना सर.
पीते हैं, सब लोग पीते हैं, बराबर, बिकॉज अच्छा है, इट्स गुड. लेकिन वो दूध आने के लिए पिटोसिन लगता है. हेलो, हाँ हाँ, ते उरलेले हे करा. मी एका लेक्चर मध्ये आहे, मला वेळ लागणार आहे. हा, बरं तेवढे करा, नंतर बघू. चाल नाही तेवढे करा. चाल, ओके. हो 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 हो, ठीक आहे. Sorry, I had forgotten about my lecture, and then I was supposed to do one procedure at one place. Anyways, I'll finish this and then I'll go there. So pitocin injection की वजह से there is a milk ejaculation. So even mothers को pitocin आता है and उसके वजह से milk निकलता है at the same time. Why? Because the smooth musculature they contract. इसलिए गाय भैंस को भी बहुत जन जिनके पास तबेले है, जिनके पास है गाय भैंस, they give injection pitocin. So government is also taking action on that to avoid the free delivery to each and every person like this, so to avoid the misuse of the injection pitocin. So pitocin is to be used for the contraction of the uterus. It is very, it acts immediately. Hello? हेलो, हाँ हाँ पर्णा, हाँ कितने बजे? 5 o'clock. Yeah, 5 o'clock. Okay, okay, yeah. Yeah, I'm supposed to do one scissor only at 5 o'clock. So good, no problem. So pitocin causes contraction and it is like short acting. It acts for say 10 minutes and uska action will go away. That's the reason it's short acting. Now there's a mithargin. Mithargin, it causes a chronic, clonic, tonic contraction of the uterus. And it is very useful. In fact, in good old days, everybody used to use mithargin, but there are side effects of mithargin. Mithargin cause the sudden rise of the blood pressure. There was patient may get convulsions, which is called as eclampsia. Patient, there will be a heart failure if there is a heart problem to the patient, because suddenly the heart muscles are also contracted. Then there will be a problem with the Rh negative mothers. So all these situations we don't give mithargin. Otherwise, mithargin is very safe drug. Then there is misoprostol. Now, pitocin is a drug which needs to be in the freeze. You cannot keep it outside. It needs a temperature less than 8 degrees Celsius. So you are supposed to keep it in the freeze. Now in the peripheries, in villages, you don't have freeze, or even if the freeze is there, electricity may not be there. So if the pitocin injections are kept outside, they will lose their efficiency. That's the reason misoprostol come. Misoprostol, these are tablets. These are tablets which can be taken orally. This can be put in the vagina. It can be kept in the rectum, or while doing cesarean section, it can be kept in the uterus also. They cause a slow contraction of the uterus and little relaxation of the cervix. Thereby, if something is remaining inside, that will go out. Like so, and it's very cheap. It doesn't require any refrigeration. So it's very wonderful. And even the staff sister or junior most sister, they can give, even in periphery, in villages, they can do that. Now there's one injection called carboprost. It's a wonderful drug when it came. It's a costly one. Of course, any new thing will be costly. It causes, again, contractions like mithargin, but with the avoiding the side effects of mithargin. After giving that, there is no rise of blood pressure. There is no contractions of the heart muscles. And at the same time, there is no problem with the Rh negative patients. So it can be given. But then they understood one thing. After giving carboprost injection, some of the patients, they went into respiratory arrest and died. Now, why was so? Because they were not contracting those heart muscles, but they were contracting the bronchial muscles, the respiration. So those patients who were asthmatic, their bronchioles, their bronchial trees, trachea, the bronchial trees, they got contracted and the patient went into the respiratory arrest and died. So whenever a mother comes to you, we ask them, उसको अस्थमा है क्या, अस्थमा की ट्रीटमेंट है क्या, दम लगता है क्या, कुछ एलर्जी है क्या, because these patients are the potential candidate to go in the respiratory arrest. So we keep such be ready with these injections for emergencies. Now, as I said, oxytocin promotes the rhythmic contractions of the upper uterine segment. Uterus के भी दो भाग रहते हैं. ऊपर का भाग जो रहता है वो एक्टिवली कॉन्ट्रैक्ट होता है, नीचे का उतना एक्टिवली कॉन्ट्रैक्ट नहीं होता है. बट देन ऊपर का भाग जो रहता है, इट ब्लीड्स मोर compared to the lower portion. But then at the same time, that portion also will bleed. And if it is bleeding, we give mithargin because it contracts everything. Okay. So it has got a very short plasma half-life only of 3 minutes. Then it should be given in the drip, or you can give IM also. So in cases of PPH, you give 20 units in the 500 ml. You are not supposed to give IV bolus. That will cause the tonic contraction of the uterus. The baby will die, the uterus will rupture, and everything, all the mishaps will happen. So if you are giving IV, it has to be given in the drip, 500 ml, 20 units over 2 hours you can give. Or 10 units IM. Now, there is a methargine. Methargine, as I said, it causes the sustained tonic uterine contraction. It can be given intramuscular. It can be given IV, but the moment you give IV, the BP will shoot, patient will convulse. So don't give IV. You can give IM. The onset of action is within 2 to 5 minutes, and the half-life is more, 30 minutes. So the effect will persist for 3 hours. So by the time patient is settled, so once methargine is given, you don't require a repeat methargine, but you can require pitocin injections again. As I said, it can cause hypertension and preeclampsia. Now there is one carboprost, that is prostadine. It can be given IM or intramyometry. Intramyometry means inside the uterus. In the uterine musculature, you can give this injection. You're not supposed to give IV. If you give IV, patient will go in respiratory arrest. So no IV injection. It's only IM or intramyometry. It's very effective, but again, it requires refrigeration. It should be kept in the freeze only. At the same time, it can be repeated every 15 minutes because the half-life is short. But it's contraindicated in asthma. And the side effects are diarrhea, vomiting, nausea. So you're supposed to give injections if you are giving these injections more. Now the misoprostol, as I said, these are tablets of 200 milligram. You should give 3 tablets, and anybody can give. It promotes the uterine contractions. The routes, it can be given orally, sublingual. Sublingual means just below the tongue. It acts immediately. Within 2 minutes, it acts. You must have seen the blood pressure patients. You give Depin tablet, you just open the Depin capsule, put it just below the tongue, and the BP will fall within minutes whenever there is a hypertensive crisis. But don't do this on alone at home, because it causes a rapid drop in the blood pressure. So there can be other side effects. Don't do that. अगर Depin की गोली देनी है कैप्सूल, मुंह में दे दो. It will get down the BP in 10 to 15 minutes. And this tablet is stable at room temperature, doesn't require freeze, and easy to administer and cheaper. So the dose is 600 to 800, that is 3 to 4 tablets. And the only side effect is the shivering. Patient को ठंड लगती है, बुखार आता है कभी-कभी. That's the only side effect, otherwise no side effects. Then there are some things like, अगर ये भी सब कुछ हो गया, but there are no effect, then what do? Then you put in a balloon inside and inflate that balloon so that the pressure inside the endometrial cavity is more than that of the uterine musculature. Thereby, those vessels, they won't bleed in the uterus. Got my point? That is the basic principle. That you put in a balloon. There are various balloons available, like Sengstaken-Baltimore or Bakri balloon. So there are variety. We even Foley's catheter we can use. So we inflate that balloon inside the uterus, and from outside we give pressure so that the uterine musculature is sandwiched in between. And since the inside the pressure is more, the bleeding will stop. Now there are various operative techniques. Of that, very useful is the Billinch. Billinch was the scientist who first invented or designed these stitches. That's the reason we call it as Billinch stitches. Then there are various modifications of these stitches, and there are various procedures. The basic principle is to avoid the blood loss. To avoid the blood loss, and when there is a tone is less, there is no tone, you crumple the uterus, you contract the uterus by taking stitches, and so as you won't allow the uterus to expand. Thereby you're keeping it compressed. Now these are the various stitches. Can you see this? Like, we go all around the uterus from one side, another on the other side. Now this is the original. Now the versions, there are different versions. Like there's a scissor, then you can come from behind, ahead, go behind, come on opposite side here, come out, go behind, and come on this side, then tie in between. So these are variety. The basic principle, as I said, it's like a batua. Just crumple the uterus. Don't allow it to expand. So that is the basic principle. So we take it in the absorbable stitches like chronic catgut, number 2, number 1, and we just tie the uterus, or we just make it short so that that should not expand. Then there are sometimes bleeding areas like this. So we take a special stitches like this. These are choose square sutures, or we can occlude the specific vessels like ovarian, uterine, and thereby reducing the bleeding. I was trying to tell you this is the method of taking the billing stitches. Of course, you can just understand the principle, that is sufficient what we do. Now these are the various videos, but they are you don't require them. I'll just tell you, whenever we are taking these stitches, the ureter is very nearby. Ureter is coming from the kidneys going into the urinary bladder. Now it is very near. You can see this. This is very near, and whenever we are taking stitches, it can get caught. So we are supposed to take precautions not to occlude the ureter in such places. Now this is a stepwise devascularization we call, and we clamp all the uterine vessels. But most important is the internal iliac vessel. And for that, there is a special training required. Whenever the situation is like this, we go down posteriorly, lock both sides, the internal iliac vessels, and thereby it reduces the blood pressure in the uterus, and then the blood clots, and we get time to operate and save the patient. Now, these are the, again, methods. We won't go into that. That was the first T. That was the tone. Now, second T is the tissue. Whenever there is a delay of the placenta, more than 30 minutes, then we, as you call it, as the retained thing. So whenever there is a retention, it increases infection, or it itself can cause obstruction to the contraction, and thereby more bleeding. So what are the risk factors? Whenever there is a prior cesarean section, or prior curettage, curating, prior abortions, or prior infections, that will cause the less contraction of that uterus in that area, thereby causing the retention of the placenta or the pieces of placenta. Sometimes the placenta can be multi-lobe, like it's not only one lobe, there is another lobe, satellite lobe, and that may remain behind, and that can cause bleeding. Some patients, they will be without any risk factor, and then there will be problem. Of course, you are supposed to see the tone, understand the tone, do the sonography, and from that you will come to know that there is something is remaining inside. Sometimes the placenta is abnormally implanted. Most of the times it is implanted above at in the fundus, but sometimes it will be in the lower area of the uterus. So that is abnormal implantation, thereby causing cord tear, and the placenta will retain inside. Now, there are defective deciduous, like placenta is adherent. Means nowadays we are coming to the placenta is accreta, percreta, increta, or placenta previa. The placenta is supposed to be separated immediately within 10 minutes after the delivery. If it doesn't separate, then we try to separate it. If it isn't getting separated, then it can be infiltrating. That means placental vessels, they are entering the uterus. There is supposed to be a gap. There is supposed to be a decidua in between the placenta and the uterus, uterine myometrium. ऐसा होता है तभी वो प्लासेंटा निकल के आएगी, जब भी the vessels go inside the uterus. It is called placenta increta, percreta. अगर वो organ में से बाहर निकली तो that is called percreta. It is very dangerous, very dangerous. Almost, if it is undiagnosed and on table, you come to know the chances of patient dying because of bleeding are 99.99%. And in such cases, you immediately need to remove the uterus rather than trying to deliver a placenta. That is the best option to save the patient. Many times, patient is first time pregnant and she has landed up losing the uterus, but it is necessary to save the life of the patient. Now, as I say, there are various types. This is the normal decidua, normal placenta. There is a gap behind. This is the uterus, uterine musculation, and there is a gap between the placenta and the uterus. So this is a normal thing. Now, what is accreta? The gap is lost. And it is directly on the accreta. Still, it can be moved sometimes. But then this is increta. That means it has gone inside the uterine myometrium. And percreta means it is perforated outside the uterus. And it is most dangerous because it will enter maybe bladder, maybe intestines, And even that patient will lose bladder, the patient will lose intestines also in that operation. So removal of the retained placenta, what we do most of the times, we take a pitocin injections in 20 ml of normal saline, 10 units, and we inject in the clamped cord, umbilical cord जो होता है, उसमें हम inject करते हैं, thereby causing the displacement of the placenta. If this fails, then we call anesthetist. We give anesthesia. We start first the, as I said, 2 saline things. We give relaxing agents. Initially, we used to give halothane, but it's a lot of side effects and subcutaneous tubutarin. So nowadays we give Pavlon or ketamine, and thereby patient is relaxed. And then we do MRP. What is MRP? Manual removal of the placenta. We put our hand inside, of course, wearing gloves and everything. We try to identify the cleavage between the uterus and the placenta and try to remove. This is called MRP, manual removal of the placenta. This is the procedure. We are keeping hand inside and removing out. Now, if it is successfully we are removed, then the uterus will contract and immediately we are supposed to give oxytocin, methargine, and other agents. But then if we are not successful, then there are chances that it may be placenta accreta, pericreta, and you are supposed to prepare her for exploration, take her for exploration. She may land up with the hysterectomy, that is removal of the uterus. Now, trauma can be because of the episiotomy. As I said, during delivery, we cut that cut can extend, so that there will be episiotomy. There will be hematoma. Hematoma means there will be excess bleeding which gets organized and cause a big blood clot inside. It is called hematoma. Or there can be uterine inversion. अम्ब्रेला देखा है, बारिश में क्या होता है, बहुत सारा हवा भी छूटी है, बारिश भी हो रही है. You don't open the umbrella. What will happen? क्या होता है अम्ब्रेला को वो टाइम पे? वो पलट जाती है, उल्टी हो जाती है. सेम थिंग हैपेंस विद द यूट्राइन इन्वर्जन. हम अगर खींचे तो पूरा यूट्रस उल्टा होकर बाहर निकल के आता है, एंड दैट इज कॉल्ड यूट्राइन इन्वर्जन. एंड पेशेंट कैन डाई इन 10 minutes because of the shock, because of vessels and the nerve supply, it is also getting entangled, and then can be uterine rupture. A previous LSS के patient है, डॉक्टर ने बोला सीजर करना पड़ेगा, but then you don't listen. That patient goes to some other doctor. Patient, वो डॉक्टर बोलता है ओके ट्राई करेंगे, और प्रीवियस LSS है, बच्चा बड़ा है, कॉन्ट्रैक्शंस आ रहे हैं, नहीं आया नीचे, यूट्रस फट गया. That is very, very risky, and that is also cause of the PPH. Uterine inversion, as I said, is rare, but then अगर प्लासेंटा छूटी नहीं है, सेपरेट नहीं हुए और पुल किया तो होता है, and it is most of the times because of the excessive traction on the cord or fundal pressure. This is the situation. This is the picture of the inverted uterus. Now this is the placenta, and the uterus is there behind. Everything has come out. This is the placenta. It has come out. Now, what we say, placenta, how it looks like, it's like a blue mass protruding from the vagina. There is a hypotension and the high morbidity unless and until. What we are supposed to do, give her some relaxing agent with that same person who is identified. Supposed to put in a fist inside and put back that placenta and the uterus inside, and then give uterotonics, that is oxytocin, and try to separate the placenta. As I said, you just catch hold of that placenta and uterus and push it inside. There's a video of that. I won't show you that. Then the uterine rupture. It was less, but nowadays the incidence has increased because of the increase in the cesarean section. So any scar in the uterus, we don't advise normal delivery, though sometimes it can happen if the baby size is small. We don't give hyperstimulation with the oxytocin also with the previous scar patients, because it will rupture. And even if there is no scar, even if there is no cesarean, still it can rupture. If there is history of abortion, if there is history of more than 3 to 4 deliveries, this uterus has become weak and it can rupture. Then there can be because of the forceps delivery, as everybody knows. We try forceps also to deliver or vacuum. All is well, all is well. Amir Khan, you know, vacuum. So even during that, if it is not properly applied, the uterus can rupture. And then there will be, once the uterus ruptures, there's the bleeding starts, the baby is lost, and the even mother is lost. So you are supposed to be very careful on that. And as soon as the rupture happens, the baby, BP falls, the pulse rate rises, and all other symptoms. That's the reason. If such patient is there, you are seeing that, you should immediately tell her to take her for cesarean section or for exploration immediately. Otherwise, there are high chances of mortality. Now, as I said, the risk factors are instrumental deliveries or preeclampsia or multiple twins है, triplets है, varicosities है, prolonged second stage. Second stage यानी बहुत time लगा. Even in spite of the fact that पूरा बच्चादानी का मुंह is open, still the baby didn't come out. So in such times, the rupture can happen. Then the birth trauma, lacerations, as I said, if the baby is big or if it is टेढ़ा है, asynclitic है, then there will be tear, lacerations. So you are supposed to repair all these lacerations and tear. And even if the hematoma is, you are supposed to drain, take out the blood clot and suture it. You evaluate. If it is still bleeding, you should keep a drain. If it is more than 3 centimeter, should think of giving a blood. Now this is the thing, like this is the vagina and side is the hematoma. The bleeding has happened inside without getting revealed. It's called hematoma. It should be drained. How it looks like from outside, then there is a blood inside. So this is a hematoma. The same manner. This was the hematoma. It is drained and suture. Okay. Now there is a thrombin. That means a coagulopathy. So blood is not coagulating properly. Though the incidence is less, but still you are supposed to work out like platelets, then prothrombin time, fibrinogen, fibrin split products, and antithrombin 3 you are supposed to check. Nowadays, there is a one-brand factor, that is factor 7, which is used for the blood coagulopathy. Of course, you are supposed to give blood. Now, this is the case of rupture uterus. Uterus has given way. Everything has come out. Placenta has come out. And baby is already delivered. This is the inversion of the uterus, which is not going. That's the reason. The uterus is given the dressing. So in summary, I'll come to end of this session. I hope you are not bored. The main causes of PPH, postpartum hemorrhage, is tone, tissue, trauma, and thrombin, the 4 T's. So first thing you supposed to rule out uterine atony by palpating fundus, massaging uterus, giving pitocin, methagin, or prostaglandin, or all if needed. And I forgot to mention about the injection carbetocin. It's the latest molecule, and it is like pitocin, but it is in prevention, and it's a long acting. Once it's given, it's to be given IV, bolus dose within a minute, and it will cause proper contraction of the uterus for say 2 to 3 hours. So it's wonderful. Then tissue, rule out retained placenta by inspecting the placenta and ruling out nothing is remaining inside. Thrombin by checking the laboratory investigations. Trauma to see properly whether there is no trauma. So communication is very important in all these scenarios because patient is serious. You are supposed to tell the relatives what is going to happen, what is happening, how you are trying, and what can cause, what can go wrong, because you are supposed to take them in confidence. They deserve to know what is going wrong. You just cannot say anything and suddenly you will give some bad news. That's not done. So communication is very important, and the communication also gives a good result, because if you tell, this is the funny picture, but it's very important. You are supposed to lift the patient on the count of 3. 1, 2, और दूसरे ने पहले ही उठा दिया. The patient will fall on the count of 3. Documentation is very important for all the doctors nowadays. Whatever we give, whatever we do, whatever injections we give, at that time, how was the conditions of the patient, what happened, what we gave, what happened then. We are supposed to document. So we do that. So in conclusion, massive hemorrhage occurs in almost 3% of the obstetric cases. 90% is postpartum. The patient's die within 4 hours because of postpartum hemorrhage. Atonia is the most common thing. And if the bleeding is not controlled, then patient can go in DIC. So you are supposed to have a proper precision of the time, the the technique, and then she's my wife, she's my better half, she's an anesthetist. She always helps me for all these serious operations, and I'm very comfortable because of her. So thanks a lot, dear all, for listening to me very patiently. I know the topic may not be so relevant, but at least I must have gotten something in your mind, what to say, what to see, how to predict some alarming signals. And if even one patient, if you detect, that will be success of this lecture. Thanks a lot. And once again, thanks a lot all the professors and Dr. Patil sir for giving me this opportunity. Thank you.
Thank you, sir.
Any questions are welcome.
Yes, sir.
Yeah.
Sir, thank you so much because such lectures are very much important nowadays. Sir, my question is while curating time, yeah, it leads to PPH. Yes, PPH can happen at that time.
Yeah, it can happen. See, depends on how many weeks curating. If it gestational age, that means pregnancy is of less than 12 weeks, then there are very less chances of PPH because uterus is not that swollen. I mean, uterus is not that expanded. So it will easily contract. So very less chances of PPH. But the moment the abortion is of more than 3 months, 4 months, then the uterus is expanded, and while curating, the curettage itself, the curate may cause perforation to the uterus, that will cause bleeding, or something will remain inside, that will cause bleeding, or the uterus itself is so expanded and it's not contracting, that will cause bleeding. So the moment more than 3 months, we call it as a second trimester abortions. And you require special settings for that, you require special permission for that. You just cannot do second trimester abortions likewise. But then what you said is right. There are high chances of PPH during that.
Okay, sir. Thank you. Thank you so much.
सर मेरा क्वेश्चन कुछ अलग है। जैसे आपका सीवी मुझे मिला तो उसमें मुझे पता चला कि यू हैड वर्क इन ड्रामा लाइक डार्लिंग डार्लिंग कुरियात सदा मंगलम डॉक्टर नौरा नकुगबाई and then you have the hobbies like trekking, singing and traveling. So with such type of profession, how do you manage that sensitivity for creating the drama or to show your emotions?
Yeah, see, everybody
बऱ्याच
has
वेळा
got
असं होतं की डॉक्टर थोडेसे असं ड्राय होतात जरा असं वाटतं मला.
Yes, you're right. Exactly. अगर हॉबीज को जिंदा नहीं रखेंगे तो आपकी जो एक ह्यूमरस साइड है वो मर जाती है एंड यू बिकम वेरी प्रोफेशनल. दैट इज बैड. हम लोग सब इंसान हैं, ये जिंदगी एक ही बार मिलने वाली है. सो व्हाई नॉट एंजॉय ईच एंड एवरीथिंग. जब तक सीख रहे थे, जब तक डॉक्टर बन रहे थे, वी कुडंट डू एनीथिंग. So even darling, we did in KM Hospital. Atul Parsure, head director, and I got the permission only once I passed out from the MBBS. My father said नहीं, उसके पहले कुछ नहीं करना है. So उसके बाद ही then एक चालू किया. कुरियात सदा मंगल घटस्फोटम we did in औरंगाबाद. डॉक्टर मुल्का नकगुबाई we did in औरंगाबाद. देखो 24 घंटे रहते हर एक के पास. जो बोलता है टाइम नहीं है, उसको टाइम मैनेजमेंट नहीं आता है या उसकी उतनी तड़प नहीं है. जिसको करना है वो कैसे भी करेगा. मे बी हम लोग जो नाटक की रिहर्सल्स करते थे, इतने डायलॉग्स होते थे, वो बाय हार्ट करना. तो आफ्टर द ओपीडी 10 बजे के बाद हम एक जगह जमा होते थे. सो 10 से 12 करते थे. तो बीच में किसी का कॉल आना, किसी की इमरजेंसी आना, वो भी होता है. सो मेनी टाइम्स पूरा कोरम होता भी नहीं है. सो जितने लोग हैं उतने का बिठाओ, जो बाद में आएगा उसका बाद में सेपरेटली रखो. We used to do that. Even I sing songs in the same manner. I have found that whenever we sing, we get relieved. Because for singing, we require utilization of our right brain. Every day-to-day life, we use our left brain. But then music related activities, we require our right brain. So by utilizing both, you are happy. That's a very good thing. One should do what may be your hobby. One should give time to it. Then you will find a difference. Then you will become so happy. You are happy from within. You will give more time to the patients. You will convince them more. Whatever your field, whatever your profession, you will be doing it more efficiently. So you should do your hobbies. Follow your hobbies.
Thank you, sir. It is very inspiring to us, sir.
Sir, will you please explain about the early menopause?
Yeah. Early menopause can be genetic, can be because of the medicines, and it is called, generally the age of menopause is around 45. So anything happening before 40, what is menopause? No menses for 6 months. So if any lady doesn't get her menses for more than 6 months before the age of 40 years, that is called early menopause or premature menopause. And the causes can be genetic. अगर उसकी मम्मी को या उसकी आत्या को पहले हो चुका है, so that means उनके family में है. It's in genetic. उसके there are some HLA B27 type of genes, chromosomes are there which can cause such things. Or any history of exposure to the radiation, or any infection during her childhood, like Sheehan syndrome, which we say. Agar there is a बहुत ज़्यादा fever है, more than say 10-14 days, then the pituitary gland gets suppressed, and that will cause future early demise of these hormones, and they can be early menopause. Again, there can be some medicines if you are taking that will cause damage to the ovaries. There are surgeries like endometriosis surgery or polycystic ovarian surgeries. In the polycystic ovary, they do the drilling of the ovaries. Now, if we overshoot those drilling, then there will be loss of ovarian cortex. That can cause ovarian damage and the early menopause. So there are a variety of causes.
Yes, sir, but the girls are getting menopause in the 25 years. I get to know that, sir. Yeah.
It is genetic, and it is associated with antibodies. So you are supposed to diagnose it early by doing FSH, LH hormones on day 3 of menses. If they are on higher side, like FSH is on higher side more than 40, and LH is also on higher side more than 35 on day 3 of menses, that girl, she is landing a premature menopause, and you can take steps to increase the ovarian reserve. You can marry her fast. You can tell her to go for the childbearing fast. And you can, nowadays with the IVF facilities,
Yes.
take out their ovaries by stimulating them. And then we form embryos, we freeze them, and then we then put in back if the situation is not good for them. But then you are supposed to do anti-malarial hormone test, AMH, that is which predicts the ovarian reserve. Iska ovarian ka potential kitna hai, that will come to know. If it is less than 0.5 or 0.3, that means bad. Uska ovarian reserve बहुत कम है. She should hurry up for the childbearing.
Okay.
And then there are some drugs like to increase the ovary reserves, but it acts for some time. Then we can give hormonal support. We can give hormonal injections. And ultimately, once she is about to land, she doesn't have her indigenous hormones. We can give hormonal pills to get artificially the menses.
Okay.
Sometime. Maybe get around till the age of 40, and then we can stop.
Thank you, sir.
Yeah, welcome.
सर सर युटेरस हेल्थ कसं राखू शकतो सर आपण?
Yeah, it's a good question. See, if the patient is getting menses regularly, every 30 days, lasting for 3 to 4 days, and there is no white discharge, there is no leukorrhea, there is no itching, then it is called a healthy uterus. Now, any of these things is disturbed, like menses are coming either every 15 days, or if it is they are not coming regularly, maybe coming after 1.5 months, 2 months, then it is wrong. Or if she's not bleeding at all, maybe for 1 day, or maybe just spotting, or bleeding for 7-8 days, both the things are wrong. Or if she's getting a white discharge causing itching, so that is called as infections. So all such patients, they are supposed to undergo the clinical examination by a gynecologist. we do for speculum examination, we observe the cervix, we observe the vagina, if they are clean and healthy. If we do sonography, then we don't need to do per speculum per vagina unless until we doubt something. Otherwise, the sonography machines are so good, we can detect each and everything. Now, if the girl is unmarried, then we don't do transvaginal sonography. Otherwise, transvaginal sonography is beautiful. It's like it can detect 1 millimeter tumor also inside. So it is very nice. And on sonography, since it is a non-invasive technique, we can diagnose everything, including the ovaries. Ovaries में follicles कितने हैं, endometrium कितना है, uterus कितना है, uterus में कुछ fibroids है क्या, tumors है क्या, uterus बराबर है कि नहीं, uterus को double horn है क्या, उसमें पर्दा है क्या, कि एक ही horn है, दोनों साइड के tubes कैसे है, उसमें कुछ पानी भरा है क्या. Everything we can diagnose on sonography. So main thing is whenever there is some pain, there is or say alteration of the menstrual history, you should go to the gynecologist, get it examined or do the sonography. अगर sonography में भी नहीं समझता है, then you can go do CT scan or MRI for that matter.
Okay, sir. Thank you.
Yeah. Any other question?
Patil sir, please propose out of
Yes,
10.
madam.
Yes.
Okay, thank you, madam. Myself, Dr. Sharad Patil, Assistant Professor in Physics, SSMM College, Pachora. I deem it a great honor and a privilege to propose the vote of thanks on this occasion of the 14th online induction program. Today, I take this opportunity to express my deeper sense of gratitude and appreciation to all those made this lecture. I would like thanks our today's chief guest, Dr. Vinayak Khedkar, who honor this program with his inspirational thought on the topic of care of patient with PPH. Dr. Khedkar briefly explained the concept of PPH in very simple ways. Also, he has explained the reason of bleeding after delivery, cause for PPH, sign and symptom of PPH, treatment of PPH, and prevention of PPH. Once again, I thank one and all presented here. Thank you.
Thank you.
Thank you, sir.
Thank you very much, sir.
Thank you, sir. Thank you.
खेडकर सर थँक्यू. त्यामुळे बऱ्याचशा गोष्टी आज नवीन शिकायला भेटल्या.
Good. I'm happy.
Thank you.